And it's all about getting our hands around the transmission of the virus and trying to rein that in.
It all starts with identifying the people behind the positive cases and who they've been in contact with.
That one person that had the positive test has probably been in contact with 10 other people who are going to be in contact with 10 other people. And so they're going to get, lots of those sort of chains of transmission, they call it. So our idea is to break that chain.
Paul Mahoney with Community Care of North Carolina says contact tracing is crucial in stopping the virus. The group is working with the state health department to hire people to make those necessary calls to people who could have been exposed to COVID-19.
What we don't want to have is go back too big too quickly, and then all of a sudden we have to shut down completely in the fall again.
As more people are tested, he expects the number of cases in North Carolina to drastically increase. I learned some local health departments are perfectly equipped to handle contact tracing on their own.
We are working internally with our staff. We've repurposed our school nurses to work on this, approximately 12 15 school nurses that have been working on this along with the communicable disease team.
While others may need extra assistance.
Until we know kind of where the problem is, it's hard to know exactly how that's going to shake out.
Paul Mahoney says these jobs are mostly remote. They plan on training people virtually on how to alert people who are at risk.
Most people will just be calling folks, trying to get in touch saying, hey, heads up, you've been exposed to somebody who had the virus, so you know that.
But at the end of the day, they can only do so much.
If they would take that seriously, it's going to make a big difference in terms of the transmission of the virus, and the people they're protecting are the people closest to them. So if they understand that, I think this will work really well.